Welcome to Meet the COO, Courtney Rottman, our new career-oriented interview format by the Operations Council. My name is Neil Brown, CEO of the Operations Council. And with that, I'm very pleased to introduce our panelist, Courtney Rottman, Chief Operating Officer for Care Technology at Evernorth Health Services, a Cigna Group corporation. Courtney is based in Dallas and has more than 20 years of experience serving in operations leadership roles at such global social innovators as St. Jude Children's Research Hospital, ALSAC, Baylor Scott White Health, Susan G. Komen for The Cure, and Travelocity.com. Courtney earned a Doctorate of Business Administration, a DBA, at the International School of Management, France, and a Master of Public Service and Administration, MPSA, a JD in Law, and a BA in International Studies and History from Texas A&M University. Courtney is a certified Chief of Staff and served on the Forbes Nonprofit Council. She currently serves as Vice President on the Board of Directors at Nexus Recovery Center, a Dallas-based recovery and treatment center for women and mothers suffering from substance abuse and addiction. Courtney, welcome and thanks for joining us today.
Yeah, absolutely. I'm super happy to be here.
Excellent. Now, tell us a little bit about your current company and your role.
Sure. Well, I joined Evernorth Health Services earlier this year. I was really drawn to the position because of a leader that I used to work with. And I'm sure as you know, people follow good leaders, and I've definitely followed one here. And I've been in the healthcare space for most of my career, both in nonprofits and for-profit organizations, and I'm really drawn to trying to address some of the complex healthcare problems that we all face in our daily lives. And so that's the mission of Evernorth. They're part of the Cigna Group, so a legacy of excellence, but they're doing something different here, something innovative and exciting, and I wanted to be a part of it. So I'm responsible for helping oversee our care technology operations, and specifically what that can entail runs the gamut, everything from product delivery, design, all the way through to making sure that we have the talent, the core of who we are, to do the type of work that we're called to do. So we follow the ebbs and flows of the customer and provider needs, and we try to meet them where they are, and also meet needs that aren't yet identified or addressed yet either.
Neat. Well, let's get right to our questions. Our format is intended to get to a number of career-related questions, a so-called lightning round of Q&A. So my first question is, what inspired you to pursue a career in operations?
Yeah, well, for me, it was really just a evolutionary blessing of opening of doors, is what I refer to it as. Being ready is really at the core of who I am, trying to be ready to serve and called on when needed. And my career initially started out in a legal department. I was sitting in a seat where I was involved in a lot of contract negotiations, a lot of where the strategy and operations and implementation where they came together. And I was seeing a huge disconnect, especially in the rooms where the strategy was discussed, and then when it came time to implement, and the frustrations of really hardworking folks who were having to address the gap that was sometimes not foreseen by leaders who didn't understand how the organization worked. The people, processes, and tools were sort of considered as tactical or beneath them. And that was really frustrating for me. So I really sought out operations opportunities through sitting and listening and learning, similar to this format, hearing from people who were working in that space and trying to really represent their voice in the rooms of privilege and the tables that I was at. And so that's what really kind of helped me evolve my career into operations, and specifically many of my roles have entailed a hybrid role, both serving as a chief of staff and an operations lead. And that's where that sort of advocacy of being a chief of staff, focusing on the words of staff, was important to me. And being able to say, hey, let's make sure that we have this consideration addressed. Let's make sure we have this voice in the room, or let's get these folks in here that can speak to that, because we might have our own knowledge gap, and it makes our strategy stronger, and it helps drive the ownership of the operations when it came time to implement.
Wow, well spoken. Let's get to some of your keys to success. What do you think are some of the most significant?
You know, that's really a challenging one. Like I said, I've definitely been put in a position of privilege more times than I can count, and I'm grateful for that. Some of that had to do with readiness, like I talked about, being ready for a challenge. When somebody says, hey, we need some help with this, being able to raise my hand and say, I know a little bit about this, but I'm willing to learn and I want to help. Sometimes it was because I had a champion who said, hey, I want to bring Courtney into this conversation. I think she can help us with this. So that's really afforded me a lot of opportunities, and I'm very grateful for that. There's a couple of mentors that I've had really consistently throughout my career who I know that, you know, when given an opportunity, they didn't have to speak up and advocate for women. They just happen to be male leaders. And being in the technology space, we are a minority still, although that's rapidly changing, thanks to the good advocacy of a lot of male leaders who are inviting female leaders into the technology leadership space. And that's been really impactful. And I think it's indicative of the digital transformation that we're in, and how at its core that really involves every person. You know, having voices and people of diverse backgrounds in the room that can help provide that holistic, strategic, and operational view just makes organizations stronger. So I've been very blessed to be able to, you know, leverage those opportunities, and that truly has been the key to my success.
Wow, thank you. Roles and responsibilities of your COO or of others in general, and how has that changed over time?
Yeah, well, certainly my roles and responsibilities definitely evolve based on the organization that I've been able to serve at. Sometimes it's had a heavier, you know, marketing and development in terms of fundraising responsibility, serving tens of millions of active donors and supporters. And sometimes it's involved focusing more on, you know, clients in the traditional sense, and how we can work with our clients, whether that's in the form of a customer, a provider, a patient, to help you know, them meet their needs and objectives. But at its core, you know, as operators, we always say people, process, tools. Well, I really spend a lot of time heavily focusing on that people piece. I believe that as a COO, we have to be a jack of all trades, but at its core, people are at the center of everything that we do, whether that ranges from risk management all the way through to day-to-day oversight of operations and systems. If we don't have the talent in place, if the talent doesn't feel supported, if the talent isn't connected to the mission of what we're doing, we will fail. It is critical. And so I spend a lot of time helping make sure that we drive alignment with our staff, that our strategic conversations and our operational conversations are in continual alignment. And, you know, many days, a lot of good efforts are made, but we miss the mark. But that's what keeps it interesting for me too, because I think that as new people enter the organization, as they bring fresh perspective, as we have some of our legacy leaders help understand why something failed in the past, we can try again and make things stronger together, both with that new and blending that historical perspective of an organization. So I tend to gravitate a lot between that strategy and that deep in the trenches operational work. And like I said, that's what really helps kind of keep me fulfilled too. So quite a variable responsibility depending on what's going on.
Wow. And I noticed, of course, mentioned that you're a certified chief of staff. What are those responsibilities, and maybe in comparison to COO?
Yeah, there's so much overlap. And I think that's why my career in some instances has had both of those titles and responsibilities at once. And in the current instance I'm at right now, the chief of staff for our executive leader reports to me. And part of that has to do with coaching, but also a big part of it has to do with ensuring that operational alignment across the organization is broad reaching. It's the strategic priority of any executive leader, or it should be. And a chief of staff is responsible for executing on the strategic priorities. But like I said before, really focusing on the words of staff and making sure that people are represented, voices are represented, and that we're addressing frustrations and concerns and escalating those as appropriate. So the chief of staff role is very similar to the COO role in many respects, although I do appreciate it more when it is separated because both responsibilities can be very heady tasks to take on at once.
Got it. Thank you. So what are some of the most interesting things about your career, and maybe that you didn't expect?
Yeah, well, I certainly didn't expect to be in the seat I'm in today, especially starting off thinking that I wanted to pursue a legal career. But like I said, so much of what is interesting to me is that translation between what's we're setting out on paper or putting in a PowerPoint and what actually happens when the work needs to get done. And so spending those late nights, all-nighters early in my career, understanding what it took to get things executed makes and continues to make my job really interesting. With operations, we get to follow the flow, sort of the ebbs and flows and the needs of those that we're serving. And that always keeps me motivated, but it's ever evolving, especially in the healthcare space, like I said, I've spent most of my career there. And when I think about where we were in the early 2000s in healthcare versus where we are now, especially with the impetus and the strain that we all experienced with COVID, it has significantly evolved how healthcare is delivered, how we receive healthcare, how we think about healthcare, and to be a part of that, it's really a special moment in time and one that I know that will continue to impact us in what we do in our work and our personal lives for generations.
Yeah, no question. Healthcare had maybe one of the most challenging environments during the last few pandemic years.
Yeah.
So, okay, well, let's get to the question that aspiring COOs want to hear. What advice would you give others that seek an operations or COO career?
Yeah. So first and foremost, I would say find out what you're passionate about, what mission or sector you really want to invest your talent and your time in. I think that for me, healthcare and being able to identify that early on was really impactful and important because it kept me motivated and fueled to keep learning. As you mentioned, I've also spent a lot of time in the classroom, but I try to blend that academic with that practicum readiness, seeking out opportunities at work that were really going to push and stretch me, asking to shadow someone, asking to take on a junior assignment in an area that I knew nothing about, gave me exposure to something I might have learned in a book or on paper, but needed the practical experience for. So finding that passion first and foremost, but then trying to keep up with trends both academically and in your practice are the two most I think impactful learnings I've had in my own career and advice that I often give to other operations leaders and really anybody who's seeking to find their passion in their professional pursuits.
Wow, well, that's some great advice, and thank you so much, Courtney. Just great insights today. Wish you all the success in the future, and like to thank our attendees as well. And have a great day.
All right, thanks so much.
All right, take care.